We all know that there are some differences between cat metabolism and dog metabolism, and this can lead to cats being a bit more sensitive to certain medications. Today, I want to discuss with you which medications are toxic to cats, and all my doses mentioned in this video are from these three books: Plumb's Veterinary Drug Handbook, Problem-Based Feline Medicine, and Small Animal Clinical Pharmacology and Therapeutics. I want to get into two lists. The first one is going to be the absolutely not list. These are medications that we want to avoid by all means to give to our feline patients. And we have our second yes but list. These are useful medications with a slightly different toxicity profile than in dogs. So we need to know what to look out for and how to use these medications. Let's get right into it and start with our absolutely not list. Our first medication on our absolutely not list is paracetamol, which is a very commonly used human NSAID. And we don't use this one because in cats it can cause methemoglobinemia. These are oxidized red blood cells. This can also happen when they eat onions. Overall, cats have more sensitive red blood cells that are more easily oxidized. And it can also cause Heinz body anemia. Cats have a lower ability to metabolize this NSAID because they have a very low concentration of certain glucuronidyltransferase families. So this tends to build up and then mess up their red blood cells. Our next medication is going to be apomorphine. This is a commonly used emetic for dogs. However, in cats, this causes significant CNS depression. So we avoid this one, and a better used alternative could be xylazine to induce emesis in cats. Azathioprine is an immune suppressant medication that in cats can lead to bone marrow suppression. We will see patients having fatal leukopenia and thrombocytopenia. So we avoid this in all costs in cats, and an alternative for this medication in cats could be chlorambucil. Benzocaine is a local anesthetic. We avoid it in cats because this also causes methemoglobinemia. And it also causes laryngeal edema when applied to the larynx. Cisplatin is an antineoplastic agent. We avoid this because it causes fatal acute pulmonary edema. These cats will die in 2 to 4 days. Phenytoin is an anticonvulsant. We avoid it in cats because it causes sedation, ataxia, anorexia, and dermal atrophy. This is probably due to the prolonged half-life, which is 40 hours long, giving this medication the opportunity to accumulate in the body. Propylthiouracil is a treatment for hyperthyroidism, and we don't use this in cats because it causes lethargy, weakness, anorexia, bleeding, diathesis. And in some research that was done on this medication in cats, 9 out of 105 cats had serious side effects from receiving this medication. Scopolamine is an antiemetic that we avoid in cats because it causes undesirable behavioral changes. And sodium phosphate, given as an enema, so rectally, we avoid in cats because it can cause depression, ataxia, and vomiting, as well as bloody diarrhea. Now, these are all signs of hyperphosphatemia, which can result from sodium phosphate enema in cats, most likely because of a rapid absorption through the rectal mucosa. So that's going to be it for our absolutely not list: paracetamol, apomorphine, azathioprine, benzocaine, cisplatin, phenytoin, propylthiouracil, scopolamine, sodium phosphate. These you want to absolutely avoid in your feline patient. Let's move on to our second list of today, which is going to be our yes but list. So these medications have therapeutic value in cats, but they have a different toxicity profile. So we definitely want to be aware of how to dose it and what to look out for when we do use them. Starting with aspirin, this is an NSAID which can cause in cats hypernia, hypersensitivity, as well as hyperthermia. This is another one of those NSAIDs that has a very long half-life in cats, 38 hours, as opposed to only 9 hours in dogs, due to their low ability to glucuronidate. So we really want to prolong the dosing interval and reduce the dose on this one. So the recommended dose for this medication in cats is 10 to 20 mg per kg every 48 to 72 hours. And just to compare, dogs are receiving the same dose every 12 hours. Chloramphenicol is an antibiotic medication that can cause anemia in cats. And for this reason, the recommended dose is going to be 50 mg per cat every 12 hours versus the same dose every 6 hours in dogs. Digoxin is a cardiac glycoside which in cats who are extra sensitive to its effects can cause vomiting, anorexia, bradycardia, and arrhythmias. For this reason, the recommended dose is split per weight category. So 2 to 3 kilogram cat can receive 0.0312 milligrams every 48 to 72 hours. 3 to 5 kilogram cat can receive this same dose every 24 to 48 hours, while big chunky cats can receive this dose every 12 hours. Doxorubicin is an anti-neoplastic agent which in cats can cause renal failure. We need to lower the dose for this medication in cats, and the recommended dose is 25 mg per square meter, not per kilogram. And to compare that, the dog dose is 30 mg per square meter. Enrofloxacin is an antibiotic which in cats can cause blindness. This is a recently reported species-specific toxicity, and the recommended dose is 6 mg per kg every 24 hours. Furosemide is a very well-known and widely used diuretic to which cats are a little more sensitive than dogs. In cats, it can cause dehydration and hypokalemia. So you want to stick to a dose of 1 to 2 mg per kg every 12 hours. Griseofulvin is an antifungal agent. In cats, it can cause leukopenia, thrombocytopenia, as well as non-reversible ataxia. Let's note here that cats are at a higher risk for these complications than dogs, and specifically FIV-infected cats. This medicine is specifically contraindicated for FIV-infected cats. So if they are FIV-infected, then you might want to not use this antifungal. The recommended dose that is usable in cats that are not FIV-infected, ideally, is going to be 50 mg per kg per day, PO. This can be split up into multiple smaller doses over the day, as long as it doesn't exceed this amount. And it's recommended to give it with a fatty meal to enhance the absorption of this medication. Lignocaine is an antiarrhythmic agent. In cats, it can cause myocardial depression, as well as CNS depression. So our recommended feline dose is 0.25 to 0.75 mg per kg, IV, and slowly. Metronidazole is a widely used antibiotic agent, which in cats may cause disorientation, ataxia, seizures, and blindness. So it can cause reversible CNS toxicity in cats. Our recommended cat dose, well, not mine, but from all the sources that I've used for this video, the recommended cat dose is 10 to 25 mg per kg every 24 hours, or in case of Giardia treatment, 10 to 25 mg per kg every 12 hours. Moving on to some opioid analgesics, notably meperidine.
I couldn't find opioid analgesics notably in your Apple Music library. You can ask me to play a radio station or ask for your music in a different app.
Thank you, Apple Watch. Moving on.
No problem.
Moving on to some opioid analgesics, specifically meperidine, morphine, butorphanol, and buprenorphine. In cats, these can cause an inconsistent sedation, as well as a high risk of excitation, which we would ideally want to avoid in any surgical circumstances. So our doses for these are going to be for meperidine 3 to 5 mg per kg IM or IV. For morphine 0.1 mg per kg subcut or IM. For butorphanol 0.4 mg per kg every 6 hours subcut or 0.2 mg per kg every 6 hours IV. And for buprenorphine 0.01 mg per kg subcutaneously or intramuscularly every 8 to 12 hours. Organophosphates are commonly used insecticides. They can lead in cats to acute toxicity, which will show as salivation, vomiting, diarrhea, and tremors, or it can cause chronic toxicity, which can show as paresis or paralysis in our feline patient. These are medications that we want to be really careful with, and we might rather want to avoid. Flea collars on cats have caused symptoms ranging from simple dermatitis around the neck to even death. So there are no recommended dosages that I want to discuss here, since there are so many different products and formulations out there. Just be very careful with these. Potassium bromide is an anticonvulsant which may cause depression and severe coughing in cats. Our recommended feline dose here is 30 mg per kg per day. Tetracyclines are a group of antibiotics which in cats may cause hepatic lipidosis, increased ALT activity, tyolism, which means an increased saliva production, and anorexia. It's speculated that cats are more susceptible to tetracycline-induced hepatotoxicosis due to their unique protein metabolism. So for that reason, I did not look up the dose. Oh, that's a bummer. Oh, I did, though. I did look up the dose. Our recommended feline dose is 15 to 22 mg per kg PO every 8 hours for 14 to 28 days. Coming to our last medication on this list, thiacetarsamide. This is a slightly outdated adulticide used to treat against dirophilariasis. There has been some mixed research out there about this medication. Regarding to cats, it is not commonly used in cats. No adulticides are commonly used in cats, nor are they recommended to. However, when absolutely necessary, keep in mind that this medication causes drug fever, respiratory distress, and fulminant pulmonary edema, with some studies showing up to 25% of cats dying from pulmonary edema after having used this medication at higher doses. So be very careful with this one. And the recommended feline dose here is 2.2 mg per kg every 12 hours for 2 days. So these are all our yes but medications for cats: aspirin, chloramphenicol, digoxin, doxorubicin, enrofloxacin, furosemide, griseofulvin, lignocaine, metronidazole, meperidine, morphine, butorphanol, buprenorphine, organophosphate, potassium bromide, tetracyclines, and thiacetarsamide. I hope you learned something from this video, and remember not to treat your cat patients like your dog patients, and have a really wonderful day.